pass it off to Director Roth and then Dr. Zavelli. And then, as I said, we will open up to Q&A. So Supervisor, I'll hand it off to you.
Good morning and welcome. I am so excited to announce that Contra Costa County has set a goal to deliver 1 million doses of COVID-19 vaccine by the 4th of July. This new goal is being announced today because we in Contra Costa County believe that with our healthcare partners, we can do it. This announcement reflects President Biden and his administration's goal announced this week to administer 100 million doses in his first 100 days of his administration. Contra Costa County is ready to join that effort and to support our community to get everyone vaccinated. You know, the great thing is that the infrastructure to make this happen is either in place or coming online for the additional vaccine supply. Our Contra Costa team has worked at a pace and with a sense of purpose under the leadership of Health Director Anna Roth that has truly been inspiring. And so what we want to say to our community is that we are ready and have the capacity to achieve these goals locally. So far in Contra Costa County, we've already given out 65,000 doses since December 15th. And so to break that down, in just a little over a month, we've gone from 0 to giving approximately 5,800 doses a day. And this has been a year when we've had to learn as we go. We've had to creatively step up to never before seen challenges and work together with our partners in a way that we haven't had to in the past. I am confident that we can meet this goal. And with the full force of government, our health partners, volunteers, and community groups together, we can work together to ensure that all people in Contra Costa County are living safely, living healthy, and living well. And in the process, we'll be able to open schools and businesses. We can once again gather, and my favorite, hug. It's that commitment to our community and to the work ahead that will help us reach 1 million doses by the 4th of July.
Good morning. I'm Anna Roth. I'm the Contra Costa County Health Director and the County Health Director. It's hard to believe that we've been living with COVID-19 and its impact on our community and economy and our everyday life really for over a year now. In the past year, we've had to fundamentally rework everything. Here at Contra Costa Health Services, we've redeployed staff. We've created entirely new systems like testing, contact tracing, metrics. We have launched websites, and now we are launching and have launched, we're well into our launch of the vaccination effort. Our mission at Contra Costa Health Services is to care for and improve the health of all people all people in Contra Costa County with special attention to those most vulnerable to health problems. This focus on the most vulnerable has been top of mind for us and driving the actions and decisions throughout our pandemic response. And this continues to guide our plans to vaccinate 1 million people by July 4th. To deliver 1 million doses by July 4th. We must take every opportunity to scale up our distribution infrastructure. And just as importantly, though, we have to do this equitably. Our Contra Costa Regional Medical Center, our 11 community health centers, our mobile clinics, our outreach within our homeless services, they're all really well positioned to in these communities that are being hit hardest by COVID-19. And some of them are already underway administering vaccines. And we know that we're going to need others to reach this goal of 1 million doses by July 4th. We're grateful that we have partnerships in our community with community providers like La Clinica, like Lifelong. We're working with paramedics and fire departments across the county vaccinating people. They're vaccinating people today. We know our community-based organizations, nonprofit partners, and others are going to be instrumental in this effort, such as faith-based communities, housing authority, farm worker channels. So this is really, again, the biggest vaccine effort in history. I know I say that because it really can't be understated what we're really working towards here. And we're grateful to know that our community partners that we've called on to help us reach this challenging but obtainable goal, we're so grateful that we're going to be doing this together and that we'll be working side by side with each other to really get to that 1 million doses by July 4th. I want to now hand over to our Deputy Health Officer, Dr. Ori Savelli, to close us out. Thanks.
Good morning. My name is Ori Savelli. I'm one of the Deputy Health Officers for Contra Costa County, and I help oversee our COVID-19 operations. The COVID-19 vaccine is no doubt a reason for hope. It's a major feat of modern science, and all the evidence we have shows that it's both safe and effective. But I don't want us to lose sight of how important it is to continue to take the necessary precautions in the coming months while people wait to get vaccinated. So wearing a mask, avoiding social gatherings with people outside your household, particularly indoor gatherings, and maintaining physical distancing are still super important. Even though there's a light at the end of the tunnel, to quote President Biden, things are going to get worse before they get better. We're still in the midst of the largest surge we've had during the pandemic. For example, last week our ICU capacity was the lowest it's been since the beginning of the pandemic. As of yesterday morning, only 2.3% of staffed ICU beds in the county were available. We have 288 people with COVID in Contra Costa County hospitals right now, which is the second highest number we've seen so far. And December was the deadliest month of the pandemic in Contra Costa County. There were 145 deaths in December, which is more than a third of all the deaths from COVID through all of 2020. And January is looking like we could see as many or even more deaths from COVID in this month. So just a reminder, it's going to take a while for the vaccine to be widely available to most of our community. Supplies are trickling in, but in the meantime, COVID itself isn't taking a vacation. So I'm asking people to really think about this now that we have an antidote for COVID with these vaccines. The only obstacle is supply of the antidote and time. So please be patient. I know that pandemic fatigue is real. I feel it myself. But think to yourself, is it worth taking risks right now when the cure is only weeks or months away? So please continue to think of your neighbor, to think of your community. Your time to get vaccinated will come. You saw this ambitious goal that Director Roth laid out for us to provide 1 million doses by July 4th. And if we're all patient, the time will come and we'll all get our turn and life can return to something closer to normal. I think I'll hand it back off to Kim now for the question and answer period.
Great, thank you all. I appreciate that. So if the panelists would all turn their cameras back on, that would be super great. For our media partners, again, you can drop questions in the Q&A section, or if you want to ask them yourself, feel free to raise your hand and I'll sort of moderate the discussion here and we'll get them answered as we can. So the first question, I think, Anna, if you'll take this one, does the 1 million doses mean 1 million people fully vaccinated or 500,000 people fully vaccinated, given that 2 doses are required? So if you can clarify that for us a little bit.
Yeah, and this is a great question. It does at this point, the vaccines that are available require 2 doses per vaccine. That said, the math doesn't work that clean because at any given time, there's always some people on their second dose and some people on their first dose. And so, really what this goal is set up against, and if we were to do everybody, it would be, if we just were to think about it in just one group of people, it would be 500,000 people, right? But at any given time, there's always sort of there's a little bit of a, it isn't that linear. So there will be probably a little bit more people on their first dose than 500,000, but not all 500,000 will be on their second dose. So there's just not an easier way to sort of explain it. That said, I think the reason that we picked 1 million is because what we know is this really gives us a strong start. And I think as Dr. Savelli just pointed out, this is going to be a long haul. And what we're really trying to do by setting this goal is set a single horizon for all of us to work towards. We would love to exceed that goal, and we'll be working really hard to do that. But what we want to sort of say is this is where we know we need to go by a certain time. So hopefully that answers your question. That again, it's about doses, and we know that those doses will kind of be being distributed across people who are both getting their second and their first dose.
Great, thank you. So this next question is from Catherine Howe at the SF Chronicle. The state is considering shifting to a primarily age-based vaccine priority system. How will that affect or not affect when and how the county and providers are vaccinating residents, specifically those who are 65 and older or 75 and older, and essential workers like farm workers and teachers? So, and I think you sit on our ethical allocations committee, so maybe you can talk a little bit about the discussion that's going on there around how we prioritize these groups.
Yeah, it's a great question. And just to say that I want to start by saying I don't want to speak on behalf of the state. I think there's a lot of considerations happening in the state, and we're having those discussions, but locally also we're sort of bringing what we can bring from the state, that, whether the state is sort of taken a position, we're also trying to share what we're hearing from the state, from the various committees or groups that we're on. And we are thinking about all of those considerations. Again, I think that, it isn't an either or, it's a both and it's really about where the emphasis is going to be. One of the things that our health officer, Dr. Farnatano, talked about the last time we reported to the board was just pointing out that in our county, what we do know, and there's a lot of things we don't know, but one of the things we do know is that 89% of the people who've died from COVID-19 are really age 60 and over. And I think that's what's driving the conversation at the state to really think about how we approach this first phase of vaccine distribution. And I think the other thing that's really important to keep in mind is we do believe more products are going to come onto the market. And so we do think that there will be an opportunity in the coming weeks and months to really rethink how the distribution happens across the different groups. But we are thinking about both age, but also about equity. So I think that it's complicated, and that's why we have I think a very, very smart group of people that are really representing a wide variety of groups within our county weighing in and thinking about this with us, so that we can really make sense of those state and the federal and state recommendations and really apply them to our populations here in the neighborhoods in our community.
Great. Dr. Savelli, we have two questions that have to do with vaccine clinic locations and Max's vaccine. So maybe I can have you I'll kind of weave these two questions together and have you do this one. The first is, when will Contra Costa County have a mass vaccine clinic like the one that's taking place in San Francisco today? Will there be more centralized places where people can get vaccine? And then if you can talk about the progress of opening vaccine centers in places like Antioch and how the whole process is rolling out.
Sure. We do support the mass vaccine clinic model. We already have many sites that do large number of vaccinations a day, over 500 vaccines per day with appointments. We have scattered them throughout the community, and we would like to also add in the mass vax model where people drive up without an appointment. We just need a lot more vaccine for that. To give you a sense, we get about 12,000 doses of vaccine of first doses per week. And that's to be distributed between us and all of our partners, including Safeway, Rite Aid, John Muir, La Clinica, Lifelong, the county sites. And so one mass vax clinic takes about 10,000 doses, 5 to 10,000 doses. So we just don't have enough vaccine to support that right now. But as soon as that supply goes up, we plan to add a mass vax clinic, and we're already making plans, exploring sites and partners to do that with. We also, the other part was about locations in Antioch.
Yeah, so Antioch particularly, but how we're kind of rolling out the opening of all of our vaccine clinics.
Oh, sure. So far, the county has, just this week, we opened a public health vaccination site at the Nick Rodriguez Community Center in Antioch. We also have other public health sites at DVC, at Contra Costa College, and starting next week at the Richmond Auditorium. Our partners at CCRMC have vaccination sites at West County Health Center, in San Pablo, in Martinez at CCRMC, and in Pittsburgh Health Center. And coming soon next week, we have vaccination happening at John Muir, both of their campuses. We also are partnering with about 16 Safeway locations and 10 Rite Aid locations, and offering vaccines through those. So we're nicely spread throughout the community.
Great, thank you for that. So there is a question that's kind of a little down in the weeds, and I might just take a quick shot at this one if you guys will indulge me for a minute. So during the last press conference, we stated that the vaccination goal was 725,000 people in 6 months. And I want to be really clear, when we presented that number, what we were doing is saying how many vaccines a day we would have to give in order to vaccinate 725,000 people in 6 months. So this 1 million doses by the 4th of July is, I think, our commitment to making that happen. They're not the same numbers. So I just want to kind of be clear about that. And Tony, if you want additional clarification about that, we can do that for you. So Anna, the question about how many folks will have their full 2-dose vaccine by July 4th. This is a tough one to answer, but maybe you can talk a little bit more about that.
Sorry. I do think this is a little bit tough to answer, because again, what we're rolling out both single and second doses. And I actually think that, we're working on doing that exact math, but we won't know, because we aren't entirely in control of the delivery arm. But you can sort of reverse the math to say it should be over 500,000. And I think that we'll be approaching the stated goal and possibly exceeding the stated goal. Again, I think it's about what kind of distribution strategy all of the partners bring forward, and we really are trying. We are trying to work towards sort of a unified and a uniform strategy, and we want to allow those community partners to determine the best way they can deliver vaccine to the communities that they're serving, and following the science. So the science really does say you get your first dose, and 21 days later approximately, if it's Moderna, you get the second dose, and it's 28 days for Moderna, 21 for Pfizer. We also know, though, that we also believe there will be other products on the market that may be single dose products. So I think that, trying to do that math is a little bit of a perilous journey. And what we're trying to do is set a very clear, simple goal so that all providers can be aiming for the same thing, which is, if we get those 1 million doses out, we will be in a very different situation come July 4th than we are in now. And we really will be able to feel very confident about moving forward with opening the economy, resuming what's next for us, in life, which will be, I think we will still, I think Dr. Savelli can speak to this, but we will still have, I think masking will still be, recommended and be doing it. But I think we can start to resume some of those activities that are all really important to all of us. And I think some of the economic activities that I think are critical to our communities. So that is really, the goal is about getting us to a safer, I think, again, about living healthy, living safely, and living well, which was what Chair Burgess started with. That is really what we're aiming for by July 4th.
So Supervisor, I'm gonna pull you into the conversation a little bit. Setting a goal like this is a bold move, and I just want to kind of get a sense from you about why you think this was an important thing to do, and how you think our community should think about this bold move.
Well, I think part of it is that the discussion that I see on the regional level is a lot of talk about the supply. And we are acknowledging today that that is the one thing that we are uncertain of. But what we are certain of is that we have the infrastructure and that we are ready to step up, that our partners are ready to step up, and that we are committed to moving this as quickly as we can. And as Director Roth indicated, there are the formulas that we're using are constantly changing, whether it's the type of vaccine that we're using or whether it's the timing between vaccinations. In the past, people have been able to just drive up, and get a vaccine if we've needed to do it. This way, we've had to do it a little differently because we're trying to get those that are most vulnerable to the virus and to try to provide these vaccines when we don't know how much is coming at any given time. So what we're trying to communicate is that we're confident because we've seen from the new administration that they have goals and that we are ready to step up and do our part.
So Director Roth, the same question for you. I mean, this is a bold move, right? You have challenged your team and kind of asked us all to step up and do this. And there obviously is value in that. And I'm hoping that you'll talk a little bit about why you saw value in doing this and how you think this will help to drive us and maintain the focus on this important piece of work.
Yeah, thank you for the question. I think that a couple of things I would say is that one thing is, one of the reasons why we picked 1 million again by July 4th is we want to have a simple aim that we can call on all of our partners to join us with. But it's not just, it's also to call on to, let the others, the state and other sort of state and federal partners know Contra Costa is ready. We have the infrastructure to deliver this vaccine to our community. We have partnerships that run very deep through our community, and we are all ready to deliver this vaccine. And so we really we are building with the assumption and that the vaccine is going to come because it has to, right? It has to come. And we really need to be prepared. And what we don't want to do is wait until we have all the answers to everything and then build. We need to be ready to hit the ground running. We have hit the ground running. All of our partners are also running with us. And so I think, again, it may sound bold, but I think that this is really a recognition of what this community, the coalition of providers across this community are ready to do and actually are already doing. So I just want to recognize the work that's already going on across the community. And every day people are calling us saying, we want to help, we're ready to help. And we want to really make it clear, both to the people who are living here and working here in Contra Costa County that we're all already working on this, but also make it clear to others if you're, that we really need everyone, that includes the state and the federal government, to do their part. Get us the vaccine, we will get it out. At any given time, I think we've also brought this up before, we have no more than a 5-day supply on hand at any given time. We are moving the vaccine as quickly as we get it. If we, and when we get more, because we believe we will move that as well. So again, I think that, and we think that other communities are starting to set aims like this as well. I think this is this is really to recognizes what's available here in Contra Costa County. So bold, yes. Doable, yes.
Great, thank you. Ori, maybe you can take this one. It's how do people sign up for appointments at those sites? Do all the appointments go through our website?
Yeah, that's a great question. Yes, the best thing to do is to go to our website, coronavirus.cchealth.org. Over there, you'll find all the information, and the information is changing. We're, putting together more ways to access vaccine over time. So over there, you'll find the vaccine tab, and everything is right there. In general, the way it works is you fill out an interest form online, and when your turn comes up through the eligible populations, which right now is mostly healthcare workers and those over 75, we will send you a link to create an appointment online. So over time, as we get through certain populations, like as we get through the elders who are over 75, we'll be going down to the next group, which is 65 to 75. So if you're over 65, you can still submit your interest form, and we'll keep it on hand, and then we'll contact you when your turn comes up.
So Supervisor, I think that you had a personal experience where you were helping some people register, and since that time we've brought the phone line on board, but maybe you have a little bit of a kind of a personal experience and maybe a message about getting help, if the form is confusing for somebody. I think you had a little bit of a personal experience with that. Am I right?
Yeah, I've actually my stepmom and my father are getting their first vaccines today at the Nick Rodriguez Center. And it took a little bit of working together. So I'd like to encourage people to reach out to your elders and to help them. It can be overwhelming, and particularly at a time when folks have been isolated and they may be feeling a little down and overwhelmed. This is the time to celebrate that we can help each other. And it is getting easier. We've put in a new system that when you register, it will acknowledge that you are now in the system, which I think created a little bit of confusion. I think the other thing that people need to remember is that a lot of people are in the queue now. And so we need to be patient. And the system is really trying to make sure that we get the most vulnerable, the people that are working on the front lines and the people that are older, and that we are going to move through this system. But I have been very impressed. I've worked with several of my friends and constituents to help them understand the system. And I will also say that our staff has been very open to feedback and have been very responsive in trying to make it easier, more understandable, and more accessible.
So I think the hard piece to describe always is sort of the who goes first piece. So Ori, maybe I can have you take another quick run at, somebody on the higher end of 65 or older group will get an email invitation to make an appointment before somebody at age 74. So maybe you can just kind of talk really briefly about how we prioritize specifically these appointment invitations.
Sure. It's a really good question, and the question we get a lot. Essentially, it's asking, how is the county prioritizing? Every day we look at all of the appointments we have and all of the tickets that we have, interest forms that we have, and then we prioritize everyone over 75. And in general, if you're over 75 and you fill out an interest form, you will get an answer within 2 to 3 days. If we have more appointments than people over 75, then we will go down the list. So we'll start sending appointments for people over 74, and then over 73, et cetera, et cetera. The state has really asked us to use age as one of the main prioritizing categories. We are waiting for the state to send clarification on whether or not they're keeping their old tier system or switching to a purely age-based system. They've been talking about that, but we're waiting for formal word on that. So basically, we do prioritize, we accept interest from anyone over 65 right now, but we will go down in age from the 75-year-olds and older, and then go down from there as openings become available.
Thank you. So we have another question about the math. So do we have enough vaccine supply to get to this million? Are we expecting supply to flow kind of over time? So Director Roth, if I can kind of ask you to talk a little bit about how this works and the point in time count and that sort of thing.
Yeah, and also Dr. Savelli, if I don't finish this up, you can jump in. I think one of the things that's really important to keep in mind, and also really challenging, right? Really challenging is that everything related to COVID, every number we've ever talked about, case rates, mortality, effectiveness of the, vaccines, or maybe that's not a good example, but most numbers, number of vaccines coming in, number of vaccines going out, all of these numbers are a point in time. And one thing we can count on is everything's changing all the time. And I think that has been a real challenge around, communicating clearly, because often they'll be like, well, you said last week, this is what you said last week. And that was the information we knew last week. And sort of in COVID years now, in COVID months, 1 month is like a year's worth of information. And so what we're building, and I think, again, really what the goal that we've set out is really designed to sort of cut through that constantly changing information. We believe there will be, today we would not have enough vaccines to meet that goal, but we believe there will be more vaccines coming online. We believe that also that there will be higher, that production rates will go up, and we're designing against those beliefs. And those aren't just sort of a wish, right? Those are based on the experience of our last year. And so, if we're thinking about everything sort of holding steady, we're not thinking about this right. The one thing that we've learned through COVID is that you have to keep moving forward. You have to plan in advance, and you have to be ready. And so that really has been what we have set out to do. With this sort of single aim, is to really have sort of one aim that sort of cuts through and really can accommodate this ever-changing environment, and help our community drive towards getting those vaccines into everyone's arms, and really returning or moving forward to the next phase. That's really what this is all about. So it's doing the math is really important, and I think it just falls short of really accounting for all of the different variables that have been happening. And again, though we don't know, we can't really count on any one thing being constant, except for one thing, and that's that everything's going to be changing. So I just want to leave you with that, and hopefully, as you look back, you'll find that rings true for you too.
I agree with everything Director Roth said, and also just to put a plug in, we have a fantastic informatics team, and they put together a great dashboard for vaccines. So if you want to know what the point in time looks like on any given day, you can go to our website, coronavirus.cchealth.org, click on the vaccine tab, and you'll see the link to the dashboard. And you can see how many people have been vaccinated, how many first doses, how many second doses, how many have been vaccinated by city. So there's a lot of great information there for people that want to explore that.
Great. I'm going to make one last call for questions from our media partners, because those are all the ones that we have teed up. We've made our way through. But while we do that, I'd like to just kind of go around and give our panelists an opportunity to make any closing comments that they might have, any lingering thoughts that you might have. So Supervisor, we'll start with you.
Yeah, I think this has been a pretty good conversation, but I think our goal today was to declare that we are ready. We have the infrastructure in place, or it will be in place as the vaccines come in. And that is what we don't know. And we don't know what we don't know that'll come down the road as well. But we are ready to put 1 million doses into people's arms by 4th of July.
Director Roth, do you any closing thoughts you have?
Well, I loved Chair Burgess's thoughts so much. We are ready, and I just want to really thank and recognize the resilience within our community. People, we have not seen the same kinds of um, challenges as some communities across the country, and even within the state, and that really is a testament to our community, the resilience, the patience, the tenacity, the creativity, and so I just want to thank them. I also really want to recognize that we are ready, and when we say we really also want to recognize our community partners, both the large health systems that are operating in our community, but all the way to the community, nonprofits and the community-based organizations, faith-based organizations, local pharmacies. So this is, I just really want to express gratitude, and I want to express confidence in this infrastructure, and know that we will achieve our goal together. So thank you so much for allowing us to have this time to talk with you all.
Dr. Cervelli, any last thoughts?
We'll really just echo Director Roth. Yeah, I want every partner we've talked to, every clinic, every doctor, every large health system, every nonprofit, everyone wants to get this vaccination project done. I think we're ready for it. Anyone we've talked to, it's been a yes, and that's been so fantastic to see our community coming together. And we have a great team at the county. Everyone's been working very hard for over a year for our community. And I'm just grateful to all of you for your patience. We do think the vaccine will be coming, not right away. It's hard to ramp up production quickly. I think people do need to be patient, but I think that by springtime, we'll see a lot more vaccine coming our way. And as soon as it comes through, we'll get it into arms.
So thank you all for that. We appreciate the panelists being here and our media partners being here as well. And we will close this out and see you next time around.